Hello, everybody. Hopefully you can hear me okay and this goes smoothly. Um, as you can see, I tried to make a little prop for my presentation, and it's supposed to be PE. I'm not sure where the letters are, but anyway, my husband told me it just says 39. So anyway, it's supposed to be PE for my topic, which is pulmonary emboli. And I figured I'd go ahead and wear it because I did it while I was waiting for the test this afternoon and figured why not. So maybe that'll help you remember kind of what I'm talking about. So, um, my topic is pulmonary emboli. Again, it was 6.26, and we'll go from here. Okay, so there are actually two case studies for my topic. Case study number one was a 32-year-old male. So fairly young, had a sudden onset of chest pain and shortness of breath, borderline hypotension, so low blood pressure. And then, let's see, they looked at him with a TEE, and they found normal LV function and size, a large RVRA, right ventricle, right atrium pressure gradient of 84 millimeters of mercury, which anyway, that's a severe pulmonary level of hypertension. So, right ventricular severely was hypokinetic, so not moving very much at all, and a large main pulmonary saddle embolus occluded the left main pulmonary artery and partial occlusion of right pulmonary artery. We'll see a video after I'm done talking that shows that. His treatment was the TPA. It did not decrease his embolus size. The patient remained stable in normal intensive with 250 milliliters of bolus normal saline and dopamine drip, and Coumadin was initiated. So a little information on this. TPA, sometimes you've heard it as I've heard of it as a clot buster. Definition, it's also called a thrombolytic. So it's a drug that is able to dissolve a clot and reopen an artery or vein. And then Coumadin is just a blood thinner. So I think that's all on this slide. I'll give you a minute if you're writing anything down. Forget me. If you can't tell, I'm not very good with technology. Okay, here we go. Next. No, that's not right. Okay, yes. So case study number two. So an older fella, 83-year-old male, he was having recurrent dizziness and acute renal or kidney failure. It's not the chronic, that necessarily required dialysis, but an acute episode or sudden onset. On admission, he became unresponsive and acutely had acute shortness of breath. He was emergently intubated and placed on mechanical ventilation. He had a TTE and TEE. So the TTE showed normal left ventricle systolic function and a dilated right ventricle and IVC. TEE, I guess they wanted to see a little more, showed a large embolus in the main pulmonary artery and a pulmonary artery systolic pressure of 55 millimeters of mercury, which is a moderate pulmonary hypertension. And that's it on him. Okay, next page. So pulmonary embolism, or abbreviation PE, or 39, you can look at my hat. What is it? I guess it's a fairly common condition. It is often fatal, which is not good news for whoever may have it. It's an obstruction of a pulmonary arterial vasculature but not limited to. There can be other things. It can be air, tumor, fat, or thrombus, consequent of these materials dislodging from other bodily locations and moving to the lungs. So these can be elsewhere in the body and then become mobile and move into the lungs, causing the pulmonary embolism. Did not have any extra information on that. Give you a second. Next page, pulmonary embolism or emboli statistics. So numbers are always nice, I guess, to put things in perspective. More than 3 million cases occur per year in the U.S. Again, I saw different stats in other resources, but I decided to go with this. 60,000 to 100,000 of those will die with those occurrences. 10 to 30% of those people will die within the first month of the diagnosis. Sudden death is one of the first symptoms in 25% of the cases, so it's really kind of a sad situation. But somebody may just die suddenly, and they may not realize what happened until an autopsy or further looking into things, and that occurs in 25% of the cases. So pulmonary emboli can last several days or weeks. It's more common in people 60 years old and older, and 33% will have a recurrence within 10 years. If they've had one, you've got a 33% chance of having one again in the next 10 years. Symptoms, most common, this is what we're going to see: shortness of breath, chest pain, or a cough. Other symptoms may include tachycardia or a rapid heart rate, arrhythmia, irregular heart rate, lightheadedness, dizziness, diaphoresis, which is excessive sweating, fever, leg pain or swelling, usually in your calf area due to deep vein thrombosis, DVT, or cyanosis, which is a blue tint to certain areas of your body, extremities especially. So a little bit more information on that. The shortness of breath, it can appear very suddenly, so a sudden onset, and it always gets worse with exertion. The chest pain, you may feel like you're actually having a heart attack, so it can be pretty severe chest pain. It's often very sharp, and you feel it more when you take a deep breath in, and which may actually interfere with you being able to take a full breath in because it is so painful. And the cough that you see here may produce bloody or blood-streaked sputum. As far as predisposition, or what may predispose you to a pulmonary emboli, there's several things. So family history of a venous thrombus or a PE, heart disease, cancer, surgery, disorders that affect clotting, prolonged immobility like bed rest or long trips, smoking, obesity, pregnancy, or supplemental estrogen. So a little bit more information about that. Cancer, looking at that here. So certain kinds of cancer can even make your chances higher of having a PE, as if having cancer isn't bad enough. But if you have brain, ovarian, pancreatic, colon, stomach, lung, kidney, or a metastatic cancer, so a cancer that started somewhere and spread somewhere else, you're at high risk for clotting. If you have those kind, chemo also increases your chances of having a PE. Females with a history of breast cancer that are taking certain medications to prevent the return of the breast cancer, like tamoxifen or raloxifene, are at a high risk of clotting also. The surgery is the leading cause of blood clots. So I'm sure have seen people in the hospital getting the little shots in their belly, and that's to prevent the clot from happening while they're lying in bed. Disorders that affect clotting, so this can often be an inherited disorder, such as kidney kidney disease, and my husband has that, and his blood will get thick, to the point sometimes they have to pull some blood off of him because of that issue. So that can affect your clotting risk. Supplemental estrogen, so down here, such as birth control pills or hormone replacement. As you get older, you're going through menopause or after menopause, the hormone replacement can increase your risk of clotting. Pregnancy. So actually the weight of the baby pressing on the veins in your pelvis can slow blood return from the legs. So that's where the clotting risk is coming there. Prevention, which is always a great thing to talk about. Several things: blood thinners, compression stockings, leg elevation, physical activity, or pneumatic compression. A little bit more information about that. The blood thinners, like we talked about before, is just the shot in the belly, in the hospital if you're lying in bed for an extended period of time, or not so extended actually. Leg elevation, so you can raise your bed at home at the foot of your bed up to 4 to 6 inches with maybe some books or blocks or something. That can be helpful. Physical activity, especially in the hospital. After you've had surgery, you're going to get that old crotchety nurse, that you're so irritated with, making you get up and walk around as soon as possible, maybe a few hours or a day within surgery, and that's for your benefit, and that's to help prevent the clotting to occur, because you want to get up and move around. And then pneumatic compression is just the air compression things they wrap around your calves while you're in the hospital, and they alternate filling up with air. It kind of massages your calf muscles and moves that blood around in your lower extremities. While traveling, it's an important thing to talk about, honestly. We see that in Branson a lot with all the tourists, the older folks who come in on the tour buses or driving in their campers, and they've been sitting there for a really long time, and they end up coming in for some sort of clot or something. It was a big issue. But if you ever have, especially older folks, traveling, remind them to take these steps here. So drink plenty of fluids, fidget in your seat or wherever. Take a break from sitting, and wear support stockings. The fluids, of course, are going to prevent dehydration. If you're dehydrated, you're going to be more likely to have some clotting happen. And you want to avoid alcohol while you're sitting for extended periods of time, because that's going to cause the dehydration. Fidgeting. So it can be as simple as just flexing your ankles every 15 to 30 minutes. Just kind of moving your ankles and feet around. And, if you're on a plane, or walk around the cabin every hour or so, or if you're in a car, stop every hour or so and walk around, for a few minutes. So that can be very helpful in having some serious issues arise. The evaluation of that, so this is all kind of wordy, but I'll just read this here. A CT scan is usually going to be typical due to the difficulty of an initial diagnosis. If renal function or kidney function permits that, and that's because with CT, often you're using contrast. I believe you can use it without contrast, so that would save your kidney risk. But if possible, CT with contrast would be preferred. TTE is frequently used to elucidate possible thrombus and determine left-right cardiac function size, right ventricle, right atrium gradient, and pulmonary artery pressure. PE can lead to right-sided pressure elevation, like we've seen in our 2 case studies, and volume overload. And then TTE can help determine need for inotropic agents, IV fluid, important for critically ill patients with massive PE. So inotropic or inotropic, the definition for that is it alters the force or energy of muscular contractions. So like the butamine in a stress echo that speeds up your heart, that's going to be a positive agent, and that's going to strengthen the force of the heartbeat. There's also negative, which would weaken the force of the heartbeat. So that's what they mean by inotropic. If you want to strengthen, or I'm assuming that was what you would want in this case, is to strengthen the heartbeat or heart muscle action. Treatment, anticoagulation is almost always initially ordered in a PE situation. An example would be heparin. You hear that a lot. The heparin or anticoagulant does not actively serve as a thrombolytic or clot buster, but it does or can prevent further thrombus formation, so adding to the thrombus you have or preventing others from developing. Thrombolytic or clot buster use is usually reserved for severely decompensated patient with cardiogenic shock and hypotension with highly probable PE. I guess there is a questionable benefit to thrombolytic, but in those cases where you may need it, it's maybe better to try than not. Clot removal, so actually going in and removing the clot somehow by surgery or some other method, and then a vein filter that would filter out the clot. So these are my sources. Mayo Clinic, always love them, CDC, and our school book. And then I have my videos. So the first one here shows the occlusion of the left main pulmonary artery, and that's right there, that big old sucker right there. Second one, here you can see the clot right here, and that's a partial occlusion of the right pulmonary artery. I'll watch that one more time, I think. Yeah, right there, you can see the blood going around it. And then in my third video, looks like a TEE, it shows a large embolism or emboli in the main pulmonary artery. That's right there. I had a pointer ready, actually, which is my husband's golf club, but I don't know that we'll use it right now, I guess. Anyway, so for my last video, it's still TEE, showing that clot again, right up there, so it's pretty big. And that's it for my presentation. Hopefully you could hear me and see me okay. You can't see that I have my Christmas tree up still. I was gonna hopefully have that in the camera, but it was too wide of a shot, so don't judge me, but I still have my tree up. But anyway, take care and hope to see y'all soon.